Okay, so let's get started. The concept of professional behaviors. So what we're looking at today is the components of professionalism in nursing. Remember, our profession is the most trusted in the world, right? So we want to make sure we keep this professionalism up. We want to keep our standards high, our ethics high. So it's our ethical principles and our clinical reasoning that makes us such a high value when it comes to our patients and the people we care for. So we want to keep that level of professionalism there where we've had it all these years. So in order for us to go forward, we have the concept, and you'll have this at every level in nursing school. So what we're looking at in here, the concepts, the things that are related are mainly collaboration, right, between our staff that we have, our clinical team, so CNAs, lab, PT, OT, ST, all of these things, or our collaborative, our physicians and things. And how do we communicate collaboratively with different levels that we're dealing with? So as the RN, we need to be able to go from the lowest level of education that we have with us, okay, up to the highest level, to that MD, to that patient that's got that PhD and things like this. So we have to be able to communicate. And then one of the hardest things we'll always be challenged with in life as well as nursing is our ethics. And I think that CEU-wise, we're required to do ethics training once a year, CEU-wise. So ethics is something that we just have to learn about and keep learning and keep up to speed, because every year it seems like there are other ethical dilemmas that are kind of hot buttons at the time. So remember, those are the areas we're dealing with. So professionalism is, is a formation, it's a process, it's a transformation, right? I mean, professionalism at the LPN level is considered a certain level, and through the Nurse Practice Act, we have those standards. We'll talk about that. But the RN is up a level higher. So we're moving up that professional process, and that takes transformation. So Benner is one of the theorists, an educational theorist, who has the 4 different levels of progression: novice, advanced beginner, competent, proficient, expert. And it takes anywhere from 3 to 5 to 6 years to complete all of these levels. And depending on, once again, your entry level as LPNs, you guys are going to be probably between novice and advanced beginner, right? Because y'all have your basic skill sets down. So your road to expert should be shorter than the students I have in level 1, correct? Who have no knowledge of what nursing is about. So 3 to 6 years is about the timeline that you have to go through your 5 levels of progression and end up at expert. So knowledge is a big component, right? And basically what students, you're a student, are required to learn to meet minimal levels of competency. So we want to keep a patient alive. We want to keep our patients safe. Those are the things that we're dealing with. That's what NCLEX is testing. They're testing your competency, your knowledge at a minimal level for nursing, okay? We're also expected to maintain and to update our knowledge base, which is our CEUs, our in-services, things like this, because look at drugs. Drugs, especially insulins, beta blockers, all the different types of drugs that are out there change constantly, okay? So we have to keep up with our profession that's a moving target and constantly moving through. So competency is the enrollment through practice. We need to remain competent through our practice. So we will be challenged for competency levels until we retire as nurses, okay? We have to know our strengths, our weaknesses, in order to attend to these competencies. We have to make sure that we are able to keep up with if we're in ICU, if we're in med-surg, if we're in the OR, those competencies will change as time goes on. So understanding different things that are out there, some of the things that are very challenging to us is the cultural, family types of things, not only technical things, but cultural. We have a dynamic that goes on here in this city, wherever we're working, cultures change quite a bit. And over the past 5 years, our cultural mix has changed in the city, okay? Ethics, as I said before, we have to look at and know what's going on. And any new procedures, technically, what's happened. And isn't it a challenge, and this would be a discussion point if we were in class, isn't it a challenge to meet the patient's individual needs? We're challenged every day to keep a competency to be able to help with those clients' needs, those patient needs that are out there. And what about documentation? Okay, we learn Epic, we get the electronic medical record under our belt, and what happens? There's an upgrade, right? All of a sudden we got an upgrade, and look at where we're going, okay? And then remember, we're caring. We have to show compassion. We have to show our ability to take care of that patient with compassion and with a competent compassion, a competent caring type of thing. All right, teamwork is part of collaboration, right? It's being able to work with our team members, okay? So we as the nurse are the spoke. We are the one that's kind of driving different things out there, and we have to know all the time what's going on with our patient. We have to be on top of our game. So as competent nurses, we have to be able to communicate with those team members. We have to know why that physical therapist is in there and what level of care that physical therapist is able to perform with our patient. What about respiratory therapy, PT, OT, ST, okay? That will enable us as nurses to get good care plans to be able to have good outcomes for our patients, right? So we're the quarterback. We're the one that's always watching. So teamwork is part of our professional responsibilities. Integrity, that's a strict moral code, okay? It's how we treat each other, how we treat our peers, how we treat our team members, how we treat our patients, you know, our ethical code. ANA has a big book, well, not a big book, but 20-something pages, 30-something pages on just ethics that are at our standards. We have standards from ANA that give us those types of guidelines, those standards to go from. As nurses, we've got to accept that feedback, you know, use feedback as a tool to improve our delivery, to improve how we're taking care of our patients. So listen to what that patient is telling us. Listen to what that family member is telling us, okay? And as always, we're accountable. If we do something, we have to take responsibility. And I don't know any one of us that hasn't made a mistake. We're gonna make mistakes. It's not if we're gonna make it, it's when we're gonna make it. So depending on what they are, they're easier to own up to, but don't be afraid to say, I'm sorry. Don't be afraid to say, I'll do better next time now that I know what's going on. And remember the Nurse Practice Act. We keep drilling that in, but that is a big important part of what's going on. So the Nurse Practice Act should be understood, and you should know from not only a legal position, but an ethical position, what's our scope of practice? What are we able to do as RNs? What are we not able to do, more importantly, right? Okay, positive attitude. I mean, we kind of, wherever you working now, they got the 5-10 rule, right? 10 feet away, smile, 5 feet away, make contact, say good morning, good afternoon. Positive attitudes, feeling good about each other. And speaking to people, just saying good morning, how are you? Just making eye contact. We're sensate beings. We like to be acknowledged by other people. So just by doing that, by maintaining that positive attitude, can really affect the way the whole unit operates. Because if one person's having a bad day, we can ruin the whole unit's attitude of that day. So go in with a positive attitude. We got a little section, one of our exemplars is, our ethics and all, so we'll talk more about that later. And then compassion is, our awareness of what other people are needing, okay? What that other person is going through, putting ourselves in their position, okay? And so as the nurse, as the quarterback, as the person who's the hub of the wheel, we have to be able to talk to our patients and our family members and look at what their needs are other than just their medical diagnosis, other than just an ICD-9 or 10 code that, this is what we need to do to keep this patient getting better in the plan of care that we're dealing with. Okay, one of the hardest things is unprofessional behaviors, right? These are defined by the Nurse Practice Act. A lot of people get in trouble for this. Loud talking, cluttered workstations, personal calls at work, substance abuse. Some of the, the first 2 or 3 are just write-ups, right? I don't know how many of y'all work on units where the unit manager deals with this, but I know at UMC where we work, that unit manager has these things right up on the board where the splits are. So he's constantly rounding, he's constantly on the lookout, he's hawking it, and he gives them little, when he walks by a nurse and he sees they're doing the right thing, he gives them like a free meal at a free Coke, a free meal, PJs, something like that. He's not punitive very often, but kind of through good reinforcement, positive reinforcement, the good nurses do better, and hopefully the other nurses see what's going on. Substance abuse, that's, what that's all about. Discrimination, as much as we don't like to talk about that, it's still around. So we need to really work through it. In nursing, I don't think it's as bad as in some other fields because we all do have to work together, but we've got to recognize it's still there. How many of y'all go to work and listen to the person going through a divorce? How many go to work and listen to all the problems that the kids are having? And is that nurse having a good day? Absolutely not. So where's that positive attitude? Absenteeism, most of y'all understand that. We've been through that. Y'all know how much it is if someone calls in. What's the problem? You can't leave your patients, and then tardiness is on top of that. That nurse that shows up 15 minutes late, half an hour late consistently, not a good setting. Okay, and then we all know now with the electronic medical record, confidentiality is like at another level, right? We cannot breach that confidentiality either through the electronic medical record or talking with people, and then gossiping, complaining to family members or to the patients. We need to understand all of those things because they are very important to keep our profession at a level that we want it to remain. Okay, abuse of powers. This is us. People look up to us. People talk to us, family members, clients, patients, people going back to work, owners of businesses want to know what's going on with the patient and if the patient's allowed us to talk to them. So we're considered pretty much a higher authority. So we have to make sure we understand those things. But because we're subject to, we have to keep above the fray, okay? Sexual harassment, improper use of our authority. Oh, I can find out about that. Let me go look in the medical record. Let me go do this. Got to be careful about those things. And then sometimes we might intimidate. We might bully. We might try to push our way around because we're used to getting things done. Because we have to use a little bit of authoritarianism when we're dealing with patients and clients sometimes, and sometimes we can overstep our bounds. So we need to be careful. We need to understand what our limitations are with our power, and we need to use them in the proper manner to remain professional. Okay, so what's our commitment to our profession? Our commitment is our state of being, what we're obligated to do and what we feel emotional, okay? So our commitment is, y'all are committed right now. Y'all want to become RNs. Y'all want to take that next step up. So you're beginning that process. You're going through that step. Then an organizational commitment is, what's your relationship to the organization? You know, with the systems in place now, with Ochsner and LCMC and situations like that, we no longer have affiliations with one or two hospitals like Touro or Children's or East Jefferson or Main Campus. You're system-wide now. What's your commitment to the systems? And the systems bring good things and bad things, okay? So when you work for a bigger organization, you got to take the good with the bad. But what's your organizational commitment to what's going on there? And then remember that nurses, and it's not just nurses, it's everywhere else, that if we want things to change and we want them to be more like the way we want it, we need to be involved with that policy, with financial decisions when we get to that point on our unit. So being actively involved out there, being on committees, being out there putting our thoughts forward are the way to get things changed. If we just sit there, go to work, come home, go to work, go home, changes never happen until we become active in making changes into those types of things. So the four factors we're looking at is what are our roles? What are the goals? I mean, as an RN, you know, your first goals, we looked at Bender. I want to become an expert nurse. What tasks do I need to learn? What are our goals? Value-wise, I know I had my own business, right? I came into this pretty much in my 50s, so maturity-wise, I was pretty good about everything, but my values changed. When I looked at the way I treated my patients, the ways I operated, I had to change some of my goals for my values that I had. So there are the mores, the values, how we deal with things. Those have to be changed and adapted to the nursing profession, because as just individual people, we have those values and mores, but we need to make sure that they adapt into nursing, okay? So we need to look at it from a personal standpoint. And then the membership, look at that third line. The membership in professional organizations is really what we're looking at there. So I doubt very seriously if y'all were in this room and asked y'all to raise your hand how many people were involved. Well, I might get one or two hands. But the great majority, do you know how many nurses there are in the state of Louisiana? And I think I've said this before, but 50,000 nurses. And at the state level, we have 1,200 nurses who are a member of the LSNA, Louisiana State Nurses Association. These, you know, by not being involved, by not being out there, it's pretty hard to get things done the way you want them to be done. So 9 times out of 10, you're going to go back and go, this is terrible, this doesn't work. And yeah, it doesn't work for you, but how do you change it? Do you just sit down there and complain about it and just go on with your business? Or do you join organizations and try to get things changed? That's what we're looking at there. And then always remember that our behaviors, and we're kind of touching on them, right? Our behaviors should be congruent with what professional parameters are for us. So we have commitment, okay? What are types of commitment? Affective is, we learned about mood and affect as one of our concepts for whatever. So affective is what? How we look, how it's how we see things. It's subjective, right? It's our attachment to the profession. What do we identify with? What's our involvement, okay? So what makes this a satisfying experience for us to get up and to say, I enjoy going to work. I enjoy being a nurse. I know that, with me now, I'm going 7 days a week now with transitions and the things that are going on. And on Saturday morning when that alarm goes off, I'm like, oh my gosh, I got to get up and go in. What's it going to be like? By the time I leave the house and I'm driving to Luling to meet up with you guys, I'm thinking, oh my gosh, this is going to be a good day. When I walk on the unit, I'm like, oh look, we got this patient and that patient. How much, this will be nice. This will be, so once I get started, it's a grind to get out of bed, I got to admit. But once I get there, I have a good experience. When I leave, I'm kind of sad the day's over. So I'm still excited as long as I feel that affective part of it, okay? So figure 42 kind of gives you a little bit about the affective commitment, okay? Then normative is our obligation. How obligated do you feel, And the way you feel that obligation is through the benefits and the positive experiences, right? So like I'm saying, when we get to clinicals and we're up on a unit and we see the students interacting with the patients and the patients smiling and laughing, and y'all do your groups, and I mean 2/3 of y'all have been through this already, so when you walk off that unit, you feel a sense of something happened today. My patient was good. I know 2 or 3 students this semester have said, when I think we had a breakthrough. When we talked to them on Saturday, we got to know them, but then Sunday, they felt a lot more comfortable. And that's the good thing. That's that normative stage. And then continuance is, I don't know about y'all, but I mean, I've worked now in this profession for going on over 10 years, and I am going to get a raise this year in January for 2%. That's my first raise. I'm not doing this for money. What's it costing me? Could I be doing something else, making more money? Probably so. But I love what I'm doing. I'm going to continue it. So the continuance has to do with cost of us. Cost of us, what happens if I leave the profession? What happens, to those types of things. So sometimes the continuance, people look at it from a negative standpoint. They looked at, oh, you never want to be a nurse. You don't want to be a nurse. That's a hard life to live. That's not a good thing. So we need to encourage other people to become nurses. And once again, from my experience, from what I've seen, if you can't find something to do in nursing, then that's pretty bad, because it's such a springboard. Case management, QI, QA, there's so many things out there. Pharmaceutical work, I mean, you can sell drugs, you can do so many things with that RN behind your name. If you can't find something that's associated with this nursing degree, I don't know what you're going to do in life, because nurses can do anything. And we bring that credibility that a lot of people don't. So remember, that commitment is a big thing, and it helps us out quite a bit. So what are stages? Okay, the first stage is exploratory. Okay, we're looking at the aspects, nursing 1, right, basic nursing. We had, 180 students, we're down to 150. 30 students have said, this doesn't work for me. The exploratory stage is not really there. Then testing is kind of where you guys are now, right? Y'all are testing the water. Do I want to take on these extra responsibilities, right? 1 year in LPN school and now a year and a half or a year or 3 semesters or however you do it with the, you know, I'm testing, I'm learning, you know, what's going to be happening here. And the second and third stage could be pretty much the same, but probably you learn to get your passion once you graduate, right? And it might not even be in that first or second year, because you may end up taking a position just to take it, being on a med-surg unit, but your passion really is cardiology, or you know, your passion is pulmonology. And it may take you a year or 2 or 3 to get into that groove that you're like, this is really what I like to do, really a good thing. Then fourth stage is I've achieved everything. I've been practicing now 4, 5, 6 years. I'm expert in my field. I've done this, this, and this, and you're just kind of cruising, okay? You could get a $2 an hour raise by going to Turo, you know, because you are very good. You're an expert. You could walk in and work on any unit, okay? So you kind of get into that fourth stage, which is quiet and bored maybe, but you're still enjoying your work. And then the final stage is just integrating and just understanding all of the good things that the profession has brought to you, and what you've accomplished and where you're going to go, what can happen in the future. So you go through the 4 stages of commitment. Managing stress, whew. Y'all know about stress, right? What? Friday, coming to school, ready to take the test, hurricane, right? What are we going to do? Where are we going to go? What's going to happen? You know, so stress is always out there, not only in school, but at your jobs. How many of y'all work 2 or 3 days a week? You're stressed out at school, you're stressed out at work, then you come back and you have stressors that you got at school that you need to get done. So y'all have to know how to handle those things. So are you able to relax? Are you able to take some time aside? When you have that downtime like we had this past weekend, were you able to put nursing school away and focus on some other things and get them done? Hopefully you can, okay? A lot of times we can turn failures into constructive learning experiences. You know, you don't learn a lot unless you fail, okay? So remember, baseball, my biggest thing is people get paid a lot of money to hit the ball 1 out of 3 times. 2 out of 3 times they fail. They don't hit the ball. But every time they swing that bat, they learn something. They try to get better the next time they get up there and swing that bat again. And same thing with us. We're going to fail. We're going to have things we don't live up to. I mean, many a night I've driven home from the hospital and nothing went wrong. It wasn't a bad day, but I could have done so much better. I could have done so much better, and I'd realize it on my way home. So I'm going to fix it the next day or the next week or whenever I have that opportunity to fix it. So turn them into learning experiences. Some things we can't change. Some things we will not be able to identify or to change. So don't hang on to those things. Just ride the pony, get over it, and then move on. Don't let that be anything that can happen. And remember that a lot of times things will happen. It'll be a stressful moment, and after we disseminate it, after we process it, we might be able to change it. We might have to be the change agent, though. We might have to go to that unit director. We may have to go to that charge nurse and say, look, can't we do something about this? Isn't there something we can do? So look at those things. Some of the facilities, especially our bigger facilities, I know we were at UMC and you know, that's a LCMC system. They were talking about the stress groups that they have. They have support groups they're now working with for the emergency room nurses, ICU, trauma people. They know that those nurses and those staff members, not only nurses, but staff members in that environment it's rough, it's tough. So they're forming support groups to do that. And then, okay, professional behaviors are definitely out there. Professional organizations, I'm sorry, are out there to help you. I know I became active pretty much as soon as I graduated. I'm a member of the state organization, ANA, the district organization. I've held offices. And what I learned from them, you know, because I mean, I was in the woe is me state, oh my gosh, look at all of this is a terrible thing. And when I looked at what other nurses were doing from other parts of the state, I'm going, oh wow, may not be that bad a deal. So anyway, look at those things, handle that stress. Leadership, Jesus, you're going to be a leader. As an RN, you are a leader by definition. You're going to have to be in charge of the team, right? You're going to have to be in charge of what's going on with that patient. So leadership's not management. It's not about, you know, it is about management, but it's leading. It's the ability to rule, to guide, to inspire, okay? That's what we're going to do. As a leader, that's what you are. As an RN, that's what you do. So you influence others, okay? You do things that are going to help other people get things done, okay? So you can be a formal leader that's been appointed, charge nurse, or, you know, the leader of a code. You know, you may be the person who's the leader in a code blue or a code white. So it's a formal type of thing, and then informal is when, you know, it's not necessarily, you know, you've been appointed anything, but people look at you and say, you know, Pete knows how to manage vents the best in this unit. You got a question? Let's go talk to Pete. And he'll come over and talk. Of course, Pete doesn't know that much about ventilators, but I'm just saying that if you have that skill set down, you may be that informal leader that people look to. So there are leadership theories in the book. Just kind of know what, I mean, we're not going to test you about a trait or behavioral or contingency, but just understand that a trait, leaders, you know, they have certain traits about them. It's like, well, why do you think so-and-so's a good leader? Well, look how they handle themselves. Look how they walk. Look how they're able to give that speech. It's a trait. Then the behavioral leaders are how a person behaves. You know, when I go into work, I make the coffee. You know, I'm always there to help you. I'm always on the unit to do things with you. My behavior tells you, my actions tell you that I'm there to support you. So behavioral types of theories. And then there's contingency. They adapt their style. They may be a trait, they may be a behavior, they may be a combination of those two. So just understand that they have those three types of things. You'll learn a lot more about leadership in the BSN level when y'all go to take that. You'll have a whole semester of that. But at the ADN level, we just want you to be introduced to it. So just look those over in the book, recognize the differences so that you'll be able to go through and have a basic understanding for the BSN. Now your leadership theories, the classical ones, autocratic, they're very authoritarian. That's where the leader makes decisions for the group. They see, an autocratic doesn't see their peers as being able to make those decisions. So they're going to make the decisions for you, okay? In some situations, depending on what's happening, like a code blue, you want an authoritarian leader. Do this, do that, give this, do that. That's what you want because it's a stressful situation. So in that case, you know Pete's leading that group and he's authoritarian, you feel secure because I've run a lot of code blues, right? So my procedures are well defined, my activities are going to be predictable, and I need to be in that mode, okay? But in the long run, in the general sense of things, it might not work on a unit so much on a day-to-day rotation because you want your staff to be creative. You want your staff to have autonomy. You want them to be self-motivated. And that authoritarian leader kind of pushes that to the side. They're not really supportive of those things. So recognize that that leadership style is probably good in emergent situations. It's probably good in some, if I got a unit that's totally off the rails and I need to get some organization there, we might need to use authoritarian leadership to get that straightened out, right? And then once we get there, we would move on to another type. Democratic is participative, it's consultative, okay? You have group discussions. You get input from your staff. The leader now acts more as a catalyst or a facilitator. So what do you want me to change? We don't like the way the schedule's done. We'd like to have more autonomy with that. Can you put it online? Let us fill in, let us do that. I'll see, okay? A catalyst, we can make changes, okay? It's probably less efficient and probably more cumbersome than autocratic because it's my way or the highway. But a lot of times it allows for motivation and creativity, right? So democratic gives us that ability. Laissez-faire, these guys are a little bit more loosey-goosey, right? They recognize autonomy and self-regulation. They try to take a hands-off approach. As long as things are going well, I'm not worried, okay? I'm kind of standing there in the background. I got you if you fall, but I'm kind of expecting you guys, y'all are all expert nurses, so y'all should be able to handle this pretty well, okay? Sometimes you get lack of coordination, right? Because I like to do it this way. I'm an expert, but Mike likes to do it this way. He's an expert too, but he does it a little bit differently. So coordination, things start to happen there. But it's most effective when you're dealing with a mature group, an expert group, people who know what they're doing and are able to deal with things as they come along, okay? Then you have bureaucratic. Most bureaucrats are government, right? I mean, that's what I think about when I hear the word bureaucrat. But they follow policies and procedures. Call up Social Security. Oh, look, I'm filing for Social Security. This happened, my wife and I, right? Can you bring in your marriage certificate? I said, well, my wife is there today, and she's meeting with her coordinator. Can she bring you the copy? It's got to be the original marriage certificate, right? And the word was, no, you have to bring it in. It's your name. I mean, that's bureaucratic leadership, is my wife, and she cannot give that to that person, right? So I got to drive to the Social Security office and prove I'm married, okay? So bureaucratic relies on rules, policies, procedures, no breaking, no bending, black and white. It's very inflexible, it's impersonal. So as you move up the administrative ladder, right, as you become director of nursing and administrative people, they're going to become more and more bureaucratic because they have to keep those standards, those policies, those procedures in place. As you move down the line, right, bedside nurse, we got to work around for everything. We can get that catheter inserted in less than 10 seconds, but there's 24 steps we should be doing according to policy and procedure, right? But we got it in, we got it done, patient's good, we're out of there. Bye, see you later. So bureaucratic. Then situational, adapts their leadership style to the situation. And I think most of us, they threw this in there as a catch-all. But no, I don't think any one style is great. But I've given you examples of styles when they're needed, and I think a good leader bounces. When you need to be authoritarian, you need to pull rank and be authoritarian. When you can be laissez-faire, you want to be laissez-faire. But the big thing is to be fair, not laissez-faire, but fair, F-A-I-R, to your staff as a leader. So recognize that you've got different ways to deal with things. Shared governance, you're going to hear that at our magnet facilities. East Jefferson, main campus are the only two we have right now. And shared governance just basically means that it's a style of leadership in the system that allows physicians and nurses and physical therapists to meet together to figure out policies and procedures and to have input into all the different ways to handle those patients and deal with things. So it's appropriate when there are big overarching group types of decisions that have to be made. Okay, so some contemporary leadership theories that we see out there are charismatic. These are the people who, what's so good about him? Well, I don't know. He's just cool. I just like him. I just follow him because he's a great person. Okay? So these people have charming personalities. They have the ability to make people feel good. They say the right things. They do the right things. A lot of your Christian, pastors and things like that have their church that are built on that pastor's personality. I mean, I know there's Duplantis out in Destrehan, there's Muley that's on the West Bank, there's probably 3 or 4 here on the East Bank. I mean, you ride by some of those churches, they're 10 acres big, they got these big congregations, 1,000, 2,000 members. I mean, a lot of money going into those churches. And a lot of good coming out of the churches, but charismatic. Transactional, they're based on exchange of resources, okay? They try to incentivize people, like I'm saying, the transactional, the unit manager that gives out little good things, here's a PJ's coffee, here's a thing. They're motivating people through positive reinforcement. They're out there saying, you do something good, you're going to get a good consequence. I'm not punitive. Not coming out and saying, oh, you left your water bottle there, you get 10 demerits. No, I'm going to say you came and you didn't have your water bottle, and I saw it was back in the break room, and I've seen you go in the break room several times to drink your water, and I give you a plus sign. So transactional kind of give you motivating type of things. Transformational, these guys are kind of far and few in between too, but they're like visionaries. They see things that you and I don't see. Now, if we could do this, then this would be so much better. If we can make this happen. So they have the ability to look at organizational visions and everything and make them into attainable goals and say, we need to do this over the next 6 months and then this over the next 6 months. And after 2 or 3 years, we'll be at this point. We'll have less falls. We'll have less this. But they recognize that they can transform things in baby steps and figure out how to do it. And then shared leadership, I think I kind of might have messed these two up and brought them together. But shared leadership and shared governance I kind of talked about already. That's that magnet type of thing. Okay, so some other things you're looking at is vision. What's that mental image, the desirable state that we're looking for? Influence. Is that leader able to influence the powers that be, that administrative team? Can they get cooperation at the top level as well as the bottom level, okay? Can they persuade? Can they communicate? Can they get their point across? Without influence, things don't go anywhere. So leaders need to have that vision and have to have that ability to influence. And of course, if I'm doing the wrong thing and I'm the leader and I'm chewing gum, here's another one for Pete Keller, I chew gum all the time. How much is that wrong in the professional behavior? Hey, darling, how you doing? Chomping on my gum. It's very unprofessional, okay? But then again, having bad breath is very unprofessional, and sometimes I go on the side of chewing gum over having bad breath. So that's not a good thing, but could I enforce chewing of gum on my unit when I was the director? Absolutely not, because I was walking around. I was not a role model. So we, as a positive role model, leaders sometimes have to change the way they do things. So a good leader is going to mentor and teach people how to do things, that mentoring part. They're going to advocate, okay, because they know that based off of the standards of care and what's out there, if they do the right things and they follow those policies and procedures and follow the standards they need to, they'll have positive outcomes for their patients, okay? They're going to be looking for evidence-based things that are different, okay? As nurses, we are now becoming a science. There's a lot more evidence-based. I think Ms. Hopkins is going to talk to y'all about that part of nursing. But I mean, there's so many journals, there's so much research going on. We have so many nurses that are jumping to that terminal degree, that doctoral prepared nurse now, that are they're doing research. And I mean, some of the things we're coming up with, it was like, wow, we just needed the data. We always thought we could do it this way, but now the data is supporting that these things are good. This way of doing it is good. So learning those types of things. A leader's got to model the way. We have to walk the walk and talk the talk. Can't expect the people around us to do things if we're not modeling what needs to be done. We need to be there on time. We need to show our professionalism. We need to stay a little later. We need to take care of that patient. We need to clean them up maybe. We need to bathe them. Anything we need to do, we need to show that we're capable of doing that. And a leader has to be a little bit of a risk taker. We have to stick our necks out of the shell. We have to be able to talk to people, to say, I think this needs to be done. And this is the right thing to do. Sometimes you're standing alone. That leader has to stand alone when they know that this is what needs to be done. And inspirational, we need to be inspirational. And when we have to be assertive, we need to assert our ability to challenge the status quo. Because 9 times out of 10, you get the thing, well, we've done it this way for 20 years. Why do we need a change? Because it's not good. We need to change it. We need to look at that. Okay, so effective nurse leaders enable others to act. Nursing will not make it without team and without enabling other people. So as a leader, I want to give credit to the staff people who are giving feedback to me and giving me good information. And then I want to enable them to be able to do things, encourage them to go out and to do those changes and to do things that need to be done. Okay? You got to look for the talents and the passions of the individual that you're working with. We don't all have the same talents. We don't all have the same passions. So the things I'm good at may not be what Mary's good at, or Jane. But Jane and Mary certainly have good attributes that Pete's not good at. So let's use the talents that our team has, and then we always have to use our trustworthiness and make sure they understand that we trust that person that we're empowering to do things for us. So effective leaders must model honest communication. So we can't kind of make it a little bit better. We can't embellish. We can't do things like that. We've got to be transparent in sharing our information that we have. So as we gather data, as we try to change things, we have to be sure that we have a transparent type of delivery. And then we should always give feedback and receive feedback. It's easy to point a finger, right? And I don't know about you, but I've said it several times, you know, I point a finger at you. You didn't go and do that blood pressure, you know, but 3 fingers are pointing back at me because Mr. Keller didn't make it clear that blood pressure should be done 2 times a shift, you know? So when I point a finger at someone and say something, I've got to be able to receive that feedback from them to let me know if I did it correctly or not, okay? Be passionate, have conviction, okay? I mean, a lot of times I get my feedback from my level 1 students and they're like, well, he's kind of rough, but he's got his heart in the right place. And you know, I have my bad days just like anybody else. And some days I'm gruff and I yell and scream, but probably I come down off my high horse and apologize and say I'm sorry for doing that. But the reason I'm convinced, or I have that conviction, is I'm passionate about what I'm doing. I want everyone to be successful. So don't mix up my conviction and my ability or my passion for you to be successful and my frustration when I don't feel like I'm doing a good job, right? So got to look at those things. Be energetic, be committed, and then be knowledgeable, okay? I mean, I've been here going on 6 years, okay? And I'm just now understanding probably 80 or 90% of the policy, of the procedure, of the way things happen. And, you know, it takes a while, right? I mean, I'm just getting to that expert stage in my teaching part of my profession. So we're always learning and know about our organizational theory. So effective leaders collaborate and educate, right? So we're collaborating all the time. And you know, the amazing thing to me that blew me away is nurses are our teachers. We teach all of the time. We're out there teaching. We need to be responsible. And look, how many times has this ethical component kicked in? So as professional people, we need to keep our ethics up. We are some of the most creative and most flexible people on this planet. Just this class, right? How much flexibility have y'all had to show, you know, from day one? I mean, just this weekend, right? Now y'all got some lectures online, you got pushed back a week. You know, y'all are going to go with the flow. Y'all are going to be flexible. That's what nurses do. That's what we usually are. We need to network and build our teams. And I don't think that this politically astute thing is taken seriously. Well, you know, there are so many things. That Nurse Practice Act, that state legislature, they deal with they're telling us what we need to do. And if we're not politically astute at the state level, at the not too much at the parish level or at our community level, but just in our organization, you know, politically astuteness is something we need to be aware of. What's happening in our culture? We need to know about that. Okay, we're almost there. Work ethic. What's our moral compass in our worth? You know, our work ethic. What's our moral compass there? You know, do we work hard? Do we work intelligently? A lot of times, you know, people do that, but they may not be living up to their full capability. I think that's what I got. You know, a lot of times I'd go back and I'd go, you know, I'm smarter than that. That was silly the way I did that way. I'm working hard, I wasn't working smart, okay? I did things kind of crazy. And then, you know, what's our task at hand? We're all guilty of this one, right? I gotta go do a catheter. That's the worst thing I hate to do. I got that order at 10 o'clock. When am I going to do that catheter? Maybe 4 o'clock? 5 o'clock? I put it off, right? Should I do that? No. Professionally, I got to go and do it when I need to. So apply yourself at the task at hand. Do those things. Get the work done correctly the first time. If you go into that room with a negative attitude, it's probably going to be a negative outcome. So try to get your head on straight, try to get things together, take responsibilities, okay? Repair damage, which hopefully there's not damage, but repair hurt feelings or something like that. And then remember that, you know, if we make an error and there's consequences to it, just accept them. Most people, once again, from that perspective, you get a chance, right? If you made this mistake once, it's not that big a deal. Just learn from your mistake. I've got to discipline you because it was a pretty bad mistake, but don't do it again. You're not going to lose your job. You know, nurses are too valuable to just say you got one offense. Now, if you do multiple offenses over and over again, bye-bye, adios, you're out of here. But normally, if you make a mistake, It's understandable. That happens. So accept those consequences. Don't take a negative thing. Some things that are kind of non-negotiable, you know, we talked about things, but attendance and punctuality, right? As nurses, we got people coming in front of us, behind us, on the side. You know, if I got the lab coming up to do something, I need to be punctual. I need to be ready when that lab shows up or when that CT tech shows up to go take the patient down, or X-ray. I can't say, oh, can you wait? When operating room comes to pick them up. You know, there's punctuality and there's attendance things we got to be aware of. Not only getting to work on time, but running our unit, running our splits, running the things we have to do. We have to know what those things are. So it's quite a task at the RN level to juggle a lot of balls that are up in the air a lot of times. But knowing those types of things, knowing that we're timely, we're there on time. I don't have to talk about punctuality and attendance, which y'all know it, y'all are LPNs. But I do have to talk about time management, about having your patient prepared, being able to prioritize, being able to take things, you know, at the right time, at the right level. So understand that attendance, getting to work on time, being punctual is a big thing, non-negotiable, but also having that time management ability when it comes to managing your patient is a big deal. Reliability and accountability, absolutely. That, without a doubt. We are consequences of our own actions, okay? 9 times out of 10, you don't do good on a test. Is it my fault? No, I mean, I'm not taking the test. And when we sit down and we remediate with students and talk about it, it's like, Mr. Keller, this happened, that happened, I know, but y'all know what you need to do. So consequences are an action of our actions, okay? So when we're out there and we're working, and I've talked about mistakes because so many times nurses do not accept these things, okay? So admit it gracefully, apologize, you know, learn from your mistake. Don't make it twice. Can't do it again, and you'll be okay. And don't get into insubordination, right? I mean, if we have a task to do, don't blow it off. I mean, my famous thing was my lactulose, right? I got my order for lactulose at 2 o'clock in the afternoon. Well, what happens? You know, it's poo-poo time, right? And so does Pete want to clean up a couple times before I get off the shift? Hand it off at handoff next day, guess who's written up? When was the order written, Pete? 2 o'clock? And you hand it off at 7. Yeah, but. No, yeah, but. You know, I mean, that's, you know, it's a medication, right? How long do we have to give a medication? An hour, right? So I was out of, did it hurt the patient? No. Did it hurt the unit? No. Did it hurt the person coming on? Yes. When they gave the medication, what did they do for the next 2 or 3 hours? Clean up poo. Was it right for Pete? No. Was that insubordination? Yes. So don't do that. That's not a good thing to do, right? All right, attitude and enthusiasm, like I said, attitude is everything. We've worked with people who came in and went, oh Lord, look at Pete. Saints lost yesterday. Pete's on a hangover. He's not going to have a good day, whatever it may be. We need to be optimistic, right? Not pessimistic. And one of the other things, I've worked with people who are so arrogant, right? I don't want to work with them because they really think poo doesn't stink, right? I mean, they just walking around like, you don't know that? Oh my God, how long have you been a nurse? Well, if I knew it, why do you belittle me, you know? So it's kind of a form of bullying or whatever, but that arrogance thing is something we've got to be, you know, we've got to have it, we've got to have confidence, but we shouldn't be arrogant, okay? We've got to really be careful with that arrogance piece of nursing. And then generational differences, okay? These are becoming more and more apparent, okay? So you've got your different cohorts. Know these cohorts. This is important in your practice. Know when the veteran groups are. Those are the 40s and the 50s. The baby boomers, that's me. I was born in the 50s and the 60s. Generation X is our next age group that we're working with. And then millennials, okay? So when I look across the classroom, when y'all are sitting here, I see a little bit of everybody. But each one of y'all, if you fit into one of those categories, which you do, will have certain tendencies that are germane to those groups. So read that in your book, understand those different generational cohorts, you know, and understand that with each generational cohort, our leadership styles are going to be different in how we work with those people. So understand that that veteran was, you know, those are going kind of out, you know, 40s. You might have some people who were born in the 40s. The baby boomers, 45 through 60. The Generation X, 61 to 80, which is probably the biggest cohort in here, or part of the cohort, and then millennials are 81 to 2000. That's the less. So I would think most of the people in here are Generation X and millennials. So look at table 40-3. They're going to give you all of those different things that we need to know about those different generational cohorts. Okay? So over the past 60 years, just by the nature of our work, things have changed, okay? So the people who are older in this cohort have a tendency to take that change a lot harder, so we need to understand how to deal with that, and we need to capitalize on the generational strengths and values that they have. So our older nurses, our more experienced nurses, those people, the baby boomers, they bring to light a lot of good things that can be used to help the newer and younger nurses to learn the passions and the goals of nursing. So understand those types of things. And I think that's pretty much it. Thank y'all. If y'all have any questions, y'all know where to get in touch with me. Adios.